Hi, everybody. My name is Jacqueline Vargas, and the topic I want to inform you guys on is oral health. Did you ever think you were doing a good job at taking care of your teeth and gums, but your dentist says otherwise? Knowing the right way to brush and floss, even taking care of a certain site after a procedure, is important to know so you know what's going on in your mouth and how to take care of it. The first thing I want to talk about is brushing. Some people think it's just about brushing. No, flossing is very important as well. Before you brush, you want to floss. So I want to show you guys a little bit on how to floss. Some people don't know how to. So what you want to do is go on in between each tooth and do like a circular motion on one side. Same thing for the other side. Go up, circular motion all the way down. You want to make sure you get all the way to the back, okay? It helps if you twist a little bit more to get all the way in those back areas. Okay? Brushing. A soft bristle brush is fine. You don't need to brush hard either when you're brushing. Circular motions, front of your teeth, the chewing surfaces of your teeth, and then the inside of your mouth. Okay? When you're brushing. And then even when you're brushing, you don't want to brush your gum lines. Brush underneath your gum lines. Okay? That helps a lot. Some people they'll brush hard, and that's not necessary. Sometimes it like you get bone loss in those areas, like you start seeing your gum recede because you're brushing too hard. Okay, the flossing it'll help, especially with like the tar plaque buildup that a person could get. Like more, a lot of people get it more on the bottom inside of their teeth. That helps to reduce that. Knowing the process of some type of treatment is important to know too, so you know what to expect, like an implant. People think that usually they get the implant that same day. That doesn't happen. An implant is something you get to help to replace that area or help that area so your teeth are not shifting. Okay, you kind of holds the space right there. People's teeth do tend to shift when you don't have something to replace a missing tooth in a certain area. The implant process, though, is they put in a body, okay? Wherever you're having that missing tooth, they put the body of the implant. The body implant takes about 4 to 6 months before they could actually put a crown on there. In 4 to 6 months, when you go back and they check the area, they check the gum level or the bone level in that area to see if it's good to do the next step, which would next step would be the crown part. The crown part, it consists of an impression with it's called we call it the abutment, okay, which is they still make, they let cut a little bit right there in that area where you have the implant. They put an abutment and we take an impression of it. And that gets sent out to the lab. The lab takes maybe, just depending, but it's usually about 2 weeks. And then to get back to us, maybe 3 weeks till you get your actual crown part put in. Okay? Knowing the correct way to take care of a certain site, especially if you have like an extraction done. When you get an extraction done, the directions that we say is like nothing hot or spicy, just kind of like ice creams, yogurt, soft foods. No drinking through a straw, no spitting directly out. If you gotta spit, kind of let it drool out over sink. No smoking, no rinsing. When I say rinsing, is like when you gargle rinse. You don't want to do that at all, okay? But the next day, starting on the next day, for 2 weeks, anytime you finish eating something, you want to rinse your mouth with warm water and salt, okay? Even the gauze, they give you extra gauze. Bite down on that. Pressure helps stop the bleeding, okay? And you want to make sure you take whatever antibiotics the doctor prescribes for you so you don't get an infection in that area. When it comes down to fillings or crowns, for those days, you want to make sure nothing hard, sticky, or chewy to eat in that area, okay? And then anything that has to do with like a root canal, crown. A person does feel like a sore tenderness in certain areas. That's normal to experience, actually, especially after procedures like that. just take whatever medication the doctor prescribes for you. That will help you a lot. I hope this was informative to you guys and you know how to take care of your teeth or know if something's going on. Go to the doctor, your dentist. Make sure you're keeping up with your checkups. That helps, especially with the cleanings. A person's actually supposed to go to the dentist every 6 months for their checkups, keep up with their oral hygiene. It helps you feel good about yourself too, knowing when you have a clean mouth or knowing our oral health is good. I hope this speech helped. Have a good day.